Gynecologists, proctologists, and urologists, what's the most awkward thing that's happened to you with a patient?
When my wife was giving birth, our gyno told her to give a big push. She did and proceeded to pee all over the doctor's face. She was wearing a protective mask for just such an occasion, so no harm no foul. Being terrified as I was that my wife was in the process of delivering our firstborn, I helpfully offered up, "Don't worry, some people pay good money for that." I still hate myself for it.
It was your first dad joke.
Last time I was at the gyno, my doctor was getting ready to start the exam while her assistant was opening one of the disposable tools. The assistant was having some issues, and as soon as I got in the stirrups, the assistant said loudly, "Man, this one's a stinker." I looked at her with my jaw dropped, and it clicked a few seconds later that she was talking about the difficulty of opening the tool, and not my vagina. It was the most fun I've ever had at the lady doctor.
In nursing school they taught us about how to insert a urinary catheter in men. There's this lidocaine lube that helps make an otherwise uncomfortable procedure considerably less comfortable. The catch is that you have to insert a syringe, not a needle, into the tip of the penis and inject lidocaine lube into the urethra and then hold the penis with your thumb over the urethra for 5 minutes. So like just hang out, holding a dick talking about the weather for 5 minutes.
Sounds like my marriage.
When they put me under for a colonoscopy, I came out of the anesthesia and asked how my penis ensmallment went. I do not recall this.
At a gyno appointment when I was 19, I was all situated on the table with my legs up, fully exposed. The doctor was adjusting her wheelie stool, it slipped, she lost her balance and went headfirst into my spread eagle crotch. Reflexively, I pulled my knees together, essentially putting her in a headlock with my thighs. It all happened in about 3 seconds but felt like an eternity of unending embarrassment and shock.
Haha. This exact thing happened to a doctor I used to work with. The lady was older, and he was flustered as hell. She said, "That's the first time I've had a face down there in years." She just laughed and laughed. He turned beet red and had to leave the room to collect himself.
Acquaintance was a 17-year-old male getting a physical from a female doctor. She was checking for a hernia, so grabbed his testicles and asked him to cough. In his nervousness, he misheard. He turned his head and did his best crow imitation, caw.
A female friend of mine told me about a gyno visit she had once. Apparently one of the instruments in the exam room looked like a microphone and she told the doctor so. Later on, the doctor wheels this device up to her vagina and asked her if there was anything she'd like to say.
While getting a prostate exam for a physical, or whatever it is where the doc sticks his fingers up your butt, I asked if he could tell I'd been doing squats. Without missing a beat he said yes.
Would you like me to give you the hands of prostate exam bot 9000?
The urologist told my wife I had perfect testicles, after he finished my vasectomy. She was sitting across the room watching every second of the procedure, while the doctor described each step from numbing, to the incision, then removing the tubes, clamping and then burning, and finally sewing it all back up. After he's done he says, "Well, that about the most perfect set of testicles I've ever worked on." So now I constantly remind her that I have medically perfect balls according to the doctors.
Pretty late here, but as the son of a gynecologist, when I was in 8th grade and my folks were out of town, a cute girl from my class came over to hang out. The first thing she sees as she walked in was a family portrait which she looked at and said, "Hey, that's my gynecologist, yikes."
I knew a girl whose gynecologist was her boyfriend's dad. The weird thing is she chose him as her doctor after they'd been together for a while. The weirder thing is she also sent her mom to him when she needed a checkup.
I see my boy's been a little rough in here. I'll tell him to ease up next time.
Urology nurse here. We had a teenager come in with his mother. We were not a pediatric urology office but saw teens on special occasions with a doctor's okay. Kid was masturbating with a cell phone charger and got it stuck in his bladder. We went in with cystoscopy to take a look and potentially remove it in office with no sedation. We enter his bladder and there is a huge knot in the cord. Kids acting like this is an everyday NBD kinda thing. Mom's just sitting there horrified. Obviously he had to go to the OR due to the giant knot tied in the cord. That was the weirdest. Also diagnosed a 19-year-old with bladder cancer that had smoked since age 12. Don't smoke, kids.
Not a doctor, but I work with urologists. I found out that there was a doctor's was nicknamed Goldfinger. Apparently he was giving a prostate examination and made the patient orgasm. Awkward for everyone involved.
I was getting snipped and they had me on some Valium. Had a great conversation with the doc. We talked about vacations, homebrew, cars, etc. When he was done he said, "I've had such a nice chat with you, I almost wish you had a third ball." Kinda made me tear up a bit.
My urologist for my vasectomy was super awkward during the consult and refused to make eye contact, so I assumed the day of the deed was going to be equally as awkward. Man, was I wrong. Dude gets me in the little OR and has his insanely attractive nurse prepping my surgical area while he proceeds to talk to me about his daughter's progress in band. Then, while he has a hole punched in my sack, which I can clearly see in the mirrored light fixture directly above me, he starts asking me about all my hobbies and whatnot like he's chatting up a blind date.
Some people are more comfortable when they see you naked and are elbows deep in sack.
You jest, but I'm a massage therapist with social anxiety. Take off all your clothes and lay face down and we can have a lovely conversation. My mom works for a urologist. She told me they once had a guy come in that injected cocaine into his dick and, after a rigorous bout of masturbation for 3 hours, he decided to go to emergency since he was still hard and it was basically purple. They had to cut it open or stick needles in it, can't remember which, to drain the blood out of it.
Patient here. Doctor asked my parents to a moment alone with me to tell me the reason my nuts were hurting was me jerking off too much. Spoiler, I was. Now that was awkward.
I'm sad to say this is a true story, but a friend of mine in high school was bragging how he got a doctor's prescription, in reality it was a recommendation, to exclusively use pocket pussies for masturbation. It turned out this was because he was cranking it so much and so hard he was ripping the skin off his own dick as well as giving his glands nerve damage. When we questioned why the fuck he was jerking so hard to rip the skin off, he shrugged and said, "I thought it was normal." My friend has to be a psychopath of some sort.
Went to a new gyno and had really bad anxiety. I was sitting on the exam table speaking to her and I passed out, fell head first onto the ground, and woke up to a room of people and an ambulance had been called. She said in her 20 years of practice that had never happened to her. Pretty cool. Edit, I should add that once I came to and realized what had happened, I didn't have my pants or underwear on. Call me hand medium light skin tone.
Not my patient but a friend told me one of his seniors walked into the theaters, saw the obese patient lying on their side on the table and shouted, "Jesus Christ, look at the size of that." Anesthetist took him outside and explained the patient wasn't anesthetized yet.
Our hospital had to put out a policy to start calling the computers on wheels, cows, workstations on wheels, wows, after a patient complained because she thought the nurses were calling her a cow.
I'm a male nurse. I was working a rehab unit one time and had to give a younger gentleman a suppository due to no bowel movement for 4 days. I saw him a couple years later in a public place and he shouts out to me, "Hey dude, remember when your finger was in my ass?" Edit, holy shit, my first silver. Thank you. Just for sticking my finger in a bum. I wasn't sure what to say, it was a little awkward. So I just did this snapping finger gun back to him. That ended up being just as awkward. If not more. Edit, I have now finger banged my way to a second silver. Thank you. Edit, yes, as a commenter said, I'm now in the Gold Finger League. Thank you.
The obvious reply is, buy me a drink and I'll do it again.
A friend of mine was having a punch biopsy done during a colposcopy after her smear test came back positive for precancerous cells. Her boyfriend went with her into the exam room to hold her hand. A camera shows on a screen what's being done. Halfway through, her boyfriend passes out and cracks his head on the wall.
My wife got an episiotomy during her first pregnancy. That's where they snipped the bottom of the vagina to make it wider. I was like, ooh, that's a lot of blood. The doctor caught it quick and had me sit down in a chair so I wouldn't pass out.
Gynecologists' report said my vagina was unremarkable. I took offense. On the flip side, mine told me I have a very cooperative cervix. Think I'll put that on my resume.
Better put it on a dating profile.
Would you like a second opinion?
Not a gyno, but my doctor is the same doctor that delivered me and all 3 of my sisters. On my first visit, as we were having a casual conversation, she stuck a finger in both my vagina and ass at the same time. I've never felt more awkward in my life, and to this day, not a single person I have asked has had a similar experience.
Was she talking about her bowling league?
Not a doctor, but when mine was checking my cervix when I was pregnant, she said I had a hand cramper, and I told her it was the nicest thing anyone had ever said to me, and I think she was embarrassed.
When I was giving birth, mine kept saying, "Wow, I just can't believe how stretchy your cervix is," and she was calling people over to come feel how stretchy it was.
I used to date a gynecologist. She told me one time this guy came into the hospital who had inserted an eggplant into his rectum. Apparently he put it in too far, because it slipped past his sphincter and went in fully. He went to the hospital for help, after lots of panicking and trying to get it out himself, I'm sure. There the doctors couldn't get it out, but one of them had the bright idea to ask the gynecologists for help because they have this vacuum device which they sometimes use when the baby gets stuck. They carefully put this device on the eggplant via the anus and pulled it out. When the patient left, they put a little beanie on the eggplant, laid it in a bed for early borns and snapped a picture while they all stood smiling next to it. I saw the picture and it was quite the funny scene. The eggplant still was in great shape too. It's a very resilient vegetable apparently.
Not in the profession, but a good friend of mine urinated blood and couldn't urinate afterwards. Without so much as a glance, the first doctor told him he had bladder cancer. He was out of town, not seeing his regular doctor. After returning home sometime later, his regular doctor prepped to examine him. Upon lying down on the table, my friend describes it as a reenactment of Old Faithful. It turns out he had a kidney stone that passed to his bladder and was slowly growing over time. Lying down made the stone float, freeing the blockage. A few laser blasts later, and he's back to normal.
Yes, this is going to get buried, but I worked in a urologist's office for a long time. It's pretty wild and I have lots of stories, my poor boyfriend, but here are two of my favorites. 1. Patients have to bring in semen samples post-vasectomy to make sure there was no issue with the procedure so we can declare them sterile. We give them 2 sterile cups, paper bags, and instructions. One patient called took the "just bring it in, hand deliver it" directions too literally and tried to shove a handful of semen through the office window. I still have so many questions. 2. Teenager comes in, thinks he might be sterile. We tell him to go home and bring us back a sample. He doesn't understand. I explain to him, professionally, that he should ejaculate into the cup we provided. He asks how. I think he's messing with me and just answer, masturbation. He asks what that is, and if his mom can help him. I don't know to this day if he was messing with me, but I'm pretty sure I just told him to Google it. Not a gynecologist but went it for an exam and she asked me when I was supposed to start my period. I told her next week as she pulled out her blood-covered fingers. Embarrassing. Edit, my highest rated comment is about bleeding on my gynecologist. Mom, we made it. One more edit, thank you kind stranger for the silver.
That blood's not mine.
Not a doctor but my friend when she went into labor drew on her belly a giant smiley face with an arrow pointing down and wrote, "This way out." The doctors and nurses thought it was hilarious. It was her 4th baby and the same doctor as the rest of her kids. She has a great sense of humor.
When I was getting the snip, my urologist commented, "Wow, you have amazing anatomy down here for this." Without missing a beat I said, "Well, that's one of the oddest compliments a lady has given me, but under the circumstances I'll take it." Thankfully she had a good sense of humor about dick and ball jokes and said it was rare a patient made her laugh considering she's heard it all. Still, joking with someone who literally has a knife to your balls might not be the greatest idea.